The number of people needing health care is rising while the cost of insurance is also rising. CBS 7's Tatum Gwen sat down with our health expert, Dr. Sudip Bose, who explained what he's calling a looming health insurance crisis.
Well, I don't know about you, but there is nothing more frustrating than having to deal with insurance. It's confusing.
It is, and you may be frustrated, and a lot of you guys out there might be frustrated with your healthcare insurance. You don't know how much something's going to cost, and when you go into your doctor, you and your doctor can't tell you how much something's going to cost. And I'm more worried than frustrated. I'm worried because if you look statistically at it, by 2030, which isn't that far away, Tatum,
no.
1 out of 2 people, 50%, are going to be obese. So between you and I, it's probably going to be me. So one of us are going to be obese, and 1 out of 3 of us by 2030 are going to have diabetes. So either me, you, or you, one of us are going to have diabetes. So in addition to that, they're aging baby boomers. So there's a big stress on our system. There's more obese people, more diabetics, and aging baby boomers incoming. And what does that mean?
More people, more demand. The demand is much higher.
And what that looks like is when you walk into an emergency room, it's overflowing, patients in the hallways, in the waiting room. So in comes health insurance. And we're not bashing health insurance here. Health insurance is a good thing. It's a pooling of money. But what I'm worried about out there is there's a publication by the American College of Emergency Physicians. And what that stated was that we're finding that patients are delaying their care. They're delaying it because they don't know how much things are going to cost, the high deductible, they're afraid. And the insurance companies, what they're calling cost cutting is really, if you look at the numbers, it's profit boosting, it's not cost cutting.
Yeah.
And then they're denying the payments. So if you come in, or you come in with chest pain, I as the physician do an EKG, a chest x-ray, blood work on a patient to make sure that it's not a heart attack.
Right.
Thankfully it's not, it's only a bronchitis. And then the claim gets denied because it was only a bronchitis. But you didn't know that when you came in.
Right.
So
then you're stuck with that bill.
Yeah, or it's denied and you're stuck with that bill, and patients should not be forced to self-diagnose their condition. This leads to dangerous insurance practices. And when you look at the Affordable Care Act, it mandated that 80% of the premiums should go to actually helping patients. Yet, 4 of the largest insurance companies had enough resources to merge. So there's a crisis looming, and don't be surprised if you're running into these problems. Many of you are. Your frustration is not alone. So just be aware the crisis is looming, it's out there. Maybe write your congressman, and you're not alone.
All right, Dr. Bose, thanks.
Thank you.